My name is Adam Gallegos. I'm a firefighter paramedic with the Castle Rock Fire and Rescue Department. And today I'm going to be demonstrating the oxygen administration scenario. First and foremost, you want to make sure that you have your body substance isolation precautions on, gloves, eyewear. You can also verbalize that for this station. First off, we're going to connect the regulator to the tank. We'll turn on the tank. We'll listen, look, feel for any kind of leaks coming out of any of the fittings in the tank. We're going to check the pressure gauge to ensure that we have enough liters in the tank to run this call and care for this patient. At this time, I'm going to grab a non-rebreather for this patient, attach it to the tank. Set my liters per minute at greater than 12 liters per minute. In this case, we'll use 15. Pre-fill my reservoir and apply the mask to the patient. At this time, your examiner will now tell you that the patient is not tolerating the mask. So we'll remove the mask, shut down the tank, grab a nasal cannula and attach it. Set my liters per minute at no greater than 6 liters a minute. In this case, we'll use 3. And apply this to the patient. At this time, your examiner will now ask you to discontinue oxygen therapy. So we'll remove the cannula. Turn off our tank. And bleed off the remaining pressure. And this concludes the oxygen administration scenario. Today I'm going to be demonstrating the airway, oxygen, ventilation skills, upper airway, adjunct, and suction scenario. First and foremost, you want to make sure that you have your BSI on, gloves, eyewear. You can also verbalize this for this station. We're going to start with an oropharyngeal airway. To select the proper size, we're going to measure from the corner of the mouth to the earlobe. We're going to insert backwards and rotate as we insert it to lip level. At this time, your examiner is going to state that the patient is gagging, so we're going to need to remove this immediately. At this time, we're going to prepare to suction the patient, selecting the proper suction catheter. Turn on the unit and ensure that we've got mechanical suction. I'm going to insert the catheter into the patient's oropharynx without suctioning. Begin suctioning on the way out. Once the patient is suctioned, your examiner will now ask you to insert a nasopharyngeal airway. Select the proper size. We're going to measure from the nostril to the angle of the jaw. You also want to make sure that you apply proper lubrication to the nasopharyngeal airway. With the bevel pointed towards the septum, you're going to insert into the right nostril. And this concludes the upper airway adjunct and suction scenario. Today we're going to be going over mouth to mask with supplemental oxygen. First off, BSI. Want to make sure that you have your gloves, eyewear on. You can also verbalize this. First, we're going to connect our one-way valve to our mask. Place the mask on the patient and ensure that we have a proper seal using the EC method. At this point, we can go ahead and start breathing for the patient. When you're breathing for the patient, you want to ensure that you have the correct tidal volume and rate. The rate for this patient, an adult patient, would be 10 to 12 breaths per minute. Next, we can connect oxygen to this mask, setting the oxygen at 15 liters per minute. Unfortunately, this type of mask we cannot connect oxygen to. They are out there, they're manufactured. If your organization carries these, this would be the time to connect the oxygen to the mask. At this point, you'll continue ventilations, and your examiner will need to observe you ventilating for a minimum of 30 seconds. And this concludes the mouth to mask with supplemental oxygen. Today we're going to be going over the Bagvalve mask in the apneic patient. First off, body substance isolations, gloves, eyewear, you can also verbalize that. First off, we're going to open the airway using the jaw thrust or the head tilt chin lift method. At this point we can add an adjunct to the airway. We'll use an oropharyngeal airway for this. Now that that's in, we'll select a proper size mask, connect it to the BVM. We'll ensure a proper seal using the EC method and begin ventilating the patient. We'll ventilate at a rate 10 to 12 breaths per minute with good tidal volume. After we've ventilated for 30 seconds, go ahead and attach the oxygen tank to the BVM, set it at 15 liters per minute. I'll continue bagging the patient. At this point, the examiner will state that there's a second EMT arriving on scene. Again, I'll ensure that the airway is open, ensure that we've got a proper seal on the mask using the EC method again. And my partner will ventilate 10 to 12 breaths per minute for another 30 seconds. And this concludes the Bagvalve mask in the apneic patient.